let's look at some of the data. And this is the key indicator. Numbers are always a little different coming off of a weekend, which is one of the reasons that we decided, frankly, to have our team look at this data every Wednesday. This is new data. But in order to make a determination about the color code that we have for every county, that determination is made at the middle of the week. You'll see here that some of the trends are continuing.
Because we all want to have a season.
So the cases last 24 hours, 948. That's down a little bit from where we've seen it, but certainly is up significantly from where it was 3 weeks ago. It's above the 21-day average. Of course, that 21-day average continues to increase as these numbers continue to go up. If you look at the deaths, those are up over the average. Hospitalizations are significantly up for that particular day, as well as the ICU admissions. So the hospital admissions are creeping up, moving up, and that is obviously of some concern, as we talked about last week. As I shared last week, I want to talk about where we are with our counties, and this is the new county risk level alert. And again, I would put emphasis on alert. It is to alert people to where their county is, to give them the opportunity to really understand the data. They can certainly go beyond the data or beyond the color and look at some of the data. But we think that this will give people a good indication of exactly where their county is. We'll get back to that in a moment. I want to share a bit more about some of the changes that we are seeing. And this is a national trend, and that is that the age of those that are being diagnosed with COVID-19 is getting younger. This is a chart that our team put together. If you look at 0 to 19, for example, in March it was about 2.5% of the total. If you look over here in June, 11.3, and then these are just partial numbers, obviously. In July, it's 13.2. If you go down to the next one, those between the age of 20 and 29, you'll see that in March it was about 12%. If you see where that is today, it's 24 and seems to be creeping up even a little bit more in July. So that's a rather dramatic change. One of the concerns that has been expressed, and I saw a story over the weekend, it was talking about the trend nationwide in having more young people who are coming down with COVID-19. And this observer said, and I quote, "The risk and mortality is going to be passed on to the most vulnerable no matter who gets it first." The risk and mortality is going to be passed on to the most vulnerable no matter who gets it first. And so that is a big concern. We are seeing some young people who are getting pretty sick. But the other concern is that they pass it on to other individuals who are older, individuals who have more medical problems. That's a great concern. Last week we talked about Franklin County, and we made the point that Franklin County was a red county, but also that it was fast approaching the next level, which would be the highest level, level 4. These are some numbers from Franklin County, and you can see the change. Cases have been increasing from June 13th to July 3rd. And what I would point out on these numbers, these are all still considered tentative. They will be filled in, so they're not complete yet. Certainly the last couple are not complete, but you can see the trend line, exactly where that is going. And again, we continue to have a great concern about Franklin County, as well as the other red counties that we're seeing. So let's go back to the map. Last week I announced our public health advisory system. Our public health advisory system uses a variety of data indicators to help us identify where the spread is increasing. Our experts believe that there's spread no matter what county you live in. It's just a question of how fast the spread is occurring and how much the spread is taking place. Currently, Ohio has 7 counties that triggered a red level 3 public health emergency. And you can see the counties, again, Hamilton County, Butler County, Montgomery County, then into Franklin County. We've got Huron County, Trumbull County, and Cuyahoga County. Franklin County, as I said, is on our watch list that's close to becoming a purple level 4 public health emergency alert, which is the highest level. Yesterday I spoke to the health commissioners in all of those 7 red counties. Some counties have 2 health departments, one in the city and one in the county. And I spoke, I believe, to every one of them. I asked them why we were seeing the spread and what their opinion was, what the data that they were seeing at the local level was. They told me pretty much the following. It's spreading at large family gatherings, birthday parties, graduation celebrations, funerals. One of the local health commissioners told me that he is seeing in their county a lot of times the same names, which would indicate to him this arises out of a family unit, or maybe family gathering of some sort. They also told me that in some cases it is spreading in the workplace, some tourist destinations, and in churches. One health commissioner told me about, tragically, how a pastor and his wife both had it, and then it spread from there. In Huron County, which is current in the red level in Huron County, one of the things as we looked at the data and got deeper into it, we did see initially spread in the non-Hispanic community, then it moved into the Hispanic community. But one of the things that we saw there as we talked to the commissioner is that 7 out of 10 current cases are in the non-Hispanic community. So they believe it's quite widespread, not just in Willard, but throughout the county. Let me just say these health departments are doing a very, very good job under some very, very difficult circumstances.